Today we're talking about VASER Hi-Def abs, or ab sculpting or ab etching. This is a procedure that patients get when they want to define their abs. Maybe they're working out all the time, maybe they're dieting and exercising, and they just really can't get those defined six packs that they want. I have a lot of patients that are personal trainers. I have a lot of patients that work out all the time. I have a lot of patients that have lost a lot of weight, dropped a lot of weight, and are doing constant sit-ups and ab workouts. They really can't get those six-pack abs to really pop.
So VASER Hi-Def is the technology that you use?
Yeah, so it's basically a technique. So the end result are six packs, abdominal, six packs, defined abs on your stomach. And to achieve that, we need to do a couple of things. One, we need to get rid of the fat that's around the muscle to really help those muscles, bellies to pop. And then two, we also want to tighten up the skin. So we achieve that with this machine called the VASER. So basically, using that technology, VASER amplified sound energy at resonance, that's ultrasound. And using an ultrasound, that helps to melt the fat. And then in combination, by melting the fat, it also heats the skin from underneath to help shrink wrap that muscle and really show off that six-pack.
So you can kind of liquefy the fat in there and then suck it out and chisel it how you want?
Correct. So you'll see on some of my videos, I'll put in the VASER, and once the VASER probe is removed, even before I do liposuction, you can see fat dripping out of the port, sort of like margarine. It's just sort of liquefied fat that's just coming out. And that's the technology of the VASER going in and using ultrasound to liquefy the fat and heat the skin.
It's also interesting because you can hear the VASER when it's not in the body going.
Yeah. So literally yesterday we had the anesthesiologist going, what is this VASER? I don't even hear it working. And it's a really high-pitched sound, and you've got to become accustomed to it. So we took the VASER probe out, we put it in water, we turned it on, and you can see it in the water with its amplification of the sound energy. So you can sort of see it on the side here on the love handle region, and he wanted to get rid of the fat. In addition, he wanted a sculpted abdomen. He didn't want to look too fakey. So on this patient, I did a small little incision at 12 o'clock in the belly button, okay? And that allowed me to create that midline, that linea alba from the sternum down to the belly button. Then I made two little incisions in the groin, and the incisions are about the size of a pencil eraser, very, very small. And from those two little incisions in the groin, I'm able to do these vertical lines up and down to get the semilunaris lines. So vertically, there are three lines. There's one in the middle, the linea alba line, and then there's two lines on the side, the semilunaris lines on the sides. You can see that here in the post-op view. And then the horizontal lines we achieve by making a little tiny incision here out of the side, boom, boom, and coming across and really getting that crisscross look. Below the belly button, you can see there shouldn't be any fat. So below the belly button, we try to eliminate all the fat to sort of get that nice and flat. So you can see the defined six-pack abs, 1, 2, 3. Again, he didn't want a 10 out of 10, ripped abs. He wanted about an 8 out of 10. So that's what we're able to achieve for him.
And that really changed the shape a lot.
Absolutely. By basically taking this shape here preoperatively, getting rid of those love handles on the side, and then post-operatively, you can see more of that V cut, that V shape. So broad shoulders going into the waistline and staying in the waistline down to the hips. That's the ideal male form as opposed to pre-op here.
So we have another female patient on the board now. Can you talk about her?
So this patient wanted to get rid of the fat and really define her abs. And she couldn't get that definition that she wanted. So on this patient, again, I made a little tiny incision in the belly button, 12 o'clock, and I sculpted out the linea alba here in the middle. I made two little incisions down in the groin. I sculpted out the semilunaris lines on the sides. And also we crisscrossed by making some horizontal transcriptions, by making little tiny incisions here and crisscrossing the abdomen to get a really defined shape. You can see on the three-quarter shot, we also got rid of some of the protuberance, the sticking out, the profile where her belly sticks out by getting rid of that fat. So I think she has an excellent result. Again, she didn't want to be overdone. She didn't want that fakey look. She just wanted to look muscular and defined. And I think we're able to achieve that on this patient.
She definitely looks like she works out here.
Absolutely. Get it?
Yeah. Are you able to combine a tummy tuck with VASER Hi-Def abs?
Sometimes. Now, it has to do with blood supply. So when we're doing a tummy tuck, we're making an incision and we're cutting across the lower portion of the abdomen. So when we cut the portion of the lower abdomen here, the point underneath the belly button gets its blood supply from the sides. All right. So if you cut it there with a tummy tuck, right below the belly button. All its blood supply is coming in from the sides. So if you do a lot of liposuction here on the sides to get rid of the love handles and doing a lot of VASER Hi-Def, you can damage those blood vessels that are providing blood supply to that area right there. So typically, when we're doing a tummy tuck, we don't do a lot of aggressive VASER Hi-Def ab sculpting. We do some, typically out in the love handle region here. Sometimes we'll do the vertical lines here, but usually we're not doing the horizontal transcriptions because of the blood supply to the lower ab here. You can always do liposuction secondarily at a later time, 4 to 6 months after the tummy tuck, to really get those defined abs. And that's where I get the best results, when we come in secondarily and sculpt out the abs.
This is my favorite result by far because
Okay.
this patient came in a year and a half after her procedure to get her after photos taken, and you can see that she's maintained these results amazingly.
Yeah. So this patient wanted as defined abdomen as I could get. She basically said, I want a 10 out of 10. Give me a ripped six pack. I want to look really athletic. I want to look like I have abs all the time, even when I'm not flexing. So to achieve these results, to maintain these results, just continue to exercise, continue to eat right, but you don't have to do 1,000 sit-ups a day to keep these results.
So a lot of people get worried about lipo belly button. Have you heard of that?
No.
They get worried that their that their belly button is gonna sag after liposuction. Can you talk about how you avoid that in the cases that we've seen?
So I guess people worry about this thing called belly button sag or lipo belly button, and that's typically when the fat around the belly button has been oversucked. So to avoid that, we don't suck as much fat around the belly button. So if you were to suck out a lot of the fat around the belly button, you get sort of a concavity, an indentation, a defect where it dips in, and the belly button skin can sag and hide the belly button. So if the belly button sort of projects out like a cup, if you do too much suction, the skin around the tip can sag. So you get sort of that sad belly button. And when you look at the belly button, you don't see the base of the belly button, which is sort of unhealthy. So if you don't suck that fat out as much, you can preserve that natural look to the belly button. So when you're looking at the belly button, you can look straight into the base of the belly button.
So as you're doing the liposuction, you control how much you take out.
Absolutely. Yeah, absolutely. So liposuction, we control how much fat we take out. So around the belly button, we're conservative. You don't take out too much fat, but you want to get the results, so you take out some fat.
And most common question of the day is Renuvion and VASER Hi-Def Lipo the same thing?
Completely different technologies. So VASER uses ultrasound. Okay, so it uses ultrasound frequency, it uses sound waves to melt the fat and to heat the skin. Renuvion uses radio frequency, so it uses radio waves, so different waves. It's like talking about microwaves and sound waves, things like that. So basically, it's completely different technology. So radio frequency are like when you dial in your AM or FM on your car radio. Those are radio frequencies. So with Renuvion, basically we've used radio frequency levels to help tighten the skin.
Do I have to work out before I get VASER Hi-Def Lipo?
Oh, no, not necessarily. So it is always good to work out every day to a certain amount, but you don't have to do like 1,000 sit-ups for 6 months, 8 months before VASER Hi-Def abs. Just work in your normal routine and then have the surgery, recover, maybe about 3 to 4 weeks, and then we integrate back into your normal preoperative exercise routine.
Do you have a BMI limit or a BMI for the best results for this procedure?
I don't, but again, the lower your BMI within reason, the better your results are going to be. Typically, we like your BMI less than 30, but you also got to consider the patient's overall weight loss history.
And who's a good candidate for VASER Hi-Def ab etching?
Patients that are looking for definition of their abs, patients that are overall healthy, they exercise, they watch your weight, there are minimal medications, and they don't smoke. And don't have too much excess skin. So if you have a lot of excess skin, you may not necessarily need VASER liposuction. You may need a tummy tuck or a body lift. Another condition that can happen is this Ninja Turtle ab look. Ninja Turtle abs are basically patients that are maybe overweight and maybe needed to lose more weight before the procedure, and unfortunately had the VASER six-pack high-def surgery and had that defined ab look, but it's superimposed on a larger belly. So it looks like those Ninja Turtles who have a large round abdomen with a sculpted six-pack on top.
Are these procedures done under local or general?
So these procedures I do under general anesthesia. Now in plastic surgery, you can do a lot of procedures under local or IV sedation, but it hurts. VASER liposuction hurts. So with VASER liposuction, I much prefer to do it under general anesthesia. And general anesthesia, why? Because it's less painful for you. I can get out more fat. I can get you better results. It's less painful with less blood loss. Those are proven in the medical studies. So most patients undergo general anesthesia when they're having the VASER Hi-Def. That doesn't mean you can't do it under local, but it's much more painful and you don't get as good a result. So the plastic surgeons that really do a lot of this VASER Hi-Def do it all under general anesthesia.
How do you avoid skin abnormalities?
So one way to avoid skin abnormalities is not to oversuck the area. And when we're talking about skin abnormalities, there are a couple of different types of skin abnormalities. There can be waviness of the skin and lumpy bumpiness of the skin, or there can be skin pigmentation changes that occur after the surgery. So to avoid the lumpy bumpies, we're consistent with our liposuction. We make sure we eliminate the fat, and the lumps are not due to retained fat or residual fat. So we make sure all the fat is sucked out and everything looks good at the conclusion of the surgery. Sometimes those lumps and bumps can occur after the surgery by collection of fluid and maybe even accumulation of scar. And usually when there's scar tissue in there, what we'd like to do is lymphatic massage, vibration therapy to really break up the scar and to smooth everything out. So usually the majority of the time, the scar, or people call it fibrosis, that happens after VASER liposuction, or really any liposuction in general, can be massaged out with these techniques of lymphatic massage, vibration therapy. Another thing that can happen with the skin after the VASER high definition is skin pigmentation changes. And for patients like that, patients that are a little bit higher risk are patients of darker skin, olive skin color, Asian skin, things like that, can lead to dark spots. When we get those dark spots, those can be treated with either skin bleaching creams or sometimes even lasers.
Have you seen a lot of celebrities get this procedure done?
Oh, absolutely. Sorry. A lot of celebrities get this procedure. You don't know it because they're not going to advertise it. They'll just say, oh, I was in the gym, or that's how I am. But, in this city of entertainment, Beverly Hills, Hollywood, the majority, regardless of what they say, of entertainers out there have had plastic surgery, and a lot of male and females have had VASER Hi-Def ab sculpting. They don't want to tell you, and we can't tell you, but they've had it.
How important are garments for recovery?
Yeah, so garments are essential for the VASER Hi-Def liposuction. I won't do it without it. You need to wear your garment for not 2 weeks, not 4 weeks, but a full 6 weeks or more if you still have swelling. So I think that's a very important component to the surgery. It helps to really minimize the swelling, and it also helps that skin to shrink wrap around the muscles to get you that better result. Also minimizes the collection of fluid in terms of seroma, like serous fluid, or hematoma, collection of blood.
What about final results? How long do we have to wait to see final results?
Now, VASER liposuction is a little bit more traumatic than traditional liposuction. So VASER liposuction takes a little bit longer to see. So with traditional liposuction, we're seeing our results maybe at about 6 to 8 weeks. With VASER liposuction, maybe it's going to be about 8 to 10 to 12 weeks before we see our final results. But it may take even longer. Maybe more of the aggressive procedures may take longer to see the results. Maybe you're a little bit more swollen, and it takes that swelling a little bit longer to go down before you see the final results. So thanks for joining Plastic Surgery 90210. So I'm Dr. Katzen, and if you'd like a consultation for VASER Hi-Def abs or any plastic surgery procedures, please leave a comment below or call the office, 310-859-7770. So thanks for watching. Please subscribe, and we'll see you next time.